I was in pain for over 2 years. I could not put my socks on. I could not put my shoes on. I couldn't bend.
The indication for hip replacement is someone that has advanced arthritis, that has significant pain, and that has failed non-operative treatment. And that can happen whether you're 40 years old or whether you're 80 years old. I think that I saw Vincent first, and then I saw Sally. When I saw Vincent, he was very debilitated. He could barely walk.
I was using a walker for about 12 years. And I'm a big chicken. Finally got to the point where it got so bad, my wife was very adamant that I needed to get it done.
Joint replacement, which is also known as joint arthroplasty, comes from the Latin term arthroplasty, which means a reforming of the joint. Basically, we take patients that have arthritic joints and we reconstitute them with metal, plastic, and ceramic implants to give them back their function in their life. The average age of hip replacement when it was first established in the 60s and 70s was about 75 years of age. Nowadays, the average age for hip replacement is about 65 years old. So we're doing hip replacements in younger patients.
My name is Aviva. I don't know if I should say my age, but I'm 48. It probably started a good few years ago. It was just kind of the wear and tear and just arthritis. Finally, it just got to a point where it was so painful. I could have been suspended like in midair and it still would hurt.
The way I phrase this with many of my patients is, as you're younger now in your 40s, should we fix your hip, give you back your quality of life, and then be pain-free in the years in your lifespan where you're most active? It was an easy decision.
I needed that now. I needed to feel good now.
We've worked very hard over the last several years to develop the Memorial Joint Replacement Center and incorporate all the different disciplines that really touch the patient.
We want you to know about pain management.
The class at the hospital was extremely important and informational, and the people at the hospital are wonderful. They answer everything, and you meet everyone that works on the floor.
Education for any joint replacement patient is paramount. We've been very successful in keeping our length of stay under 2 days. So it's imperative for our patients to understand how to prevent any kind of complications, and if any complications arise, what to do about it. It's also very important for them to know what their post-op milestones are.
Anterior approach hip surgery is less disruptive to the muscles around the hip. We go through a natural interval in the front of the hip to actually move those muscles out of the way. Sally was the brave one. She had surgery first. She had an anterior approach hip replacement. Many patients that have anterior approach surgery really get up quicker, have less pain, and have a more normalized gait.
I had no pain, 0 pain.
She was up and going in no time. As a matter of fact, once she did her surgery, she convinced Vincent to make sure that he did his. I still do the posterior approach for selected patients. Vincent had 2 posterior approaches, and Vincent's outcome was really the most remarkable. When I finally saw him at 6 weeks after his last operation, he actually walked in. It was the first time we ever saw him without a walker, and he was walking normally. And we really gave him their life back.
I woke up from the anesthesia, very bright and alert, and literally later that evening, I was already sitting in a chair, walking to the bathroom, myself.
We work with very closely our rehab physical therapists who ensure that these patients are up and out of bed, ambulating, as well as providing them comfort measures, being given the fact that they've just had a replacement surgery. Quarter to quarter, year to year, our patients, they stay on this unit on average of 2 days. We get them onto their next steps, and I see many of them come back weeks later without their walker, without their cane, and they tell me the stories. I've gone back to going skiing. I've been speed walking again, and just story after story of these folks being able to regain their life.
I love putting my shoes and socks on.
She has enough of them.
Oh.
Dr. Isla kept telling me, you'll see it's going to be life-altering, life-changing, and I said, yeah, and he was 100% correct.
When you wake up in the morning, you're not in pain. Just to see him, just out there mowing the lawn and feeling great, and it's short of a miracle, that's for sure.